Good morning, doctors. Prescribon is an e-prescribing software which helps you to generate electronic prescriptions easily. It has a huge collection of e-prescriptions for about 1,000 clinical conditions for 15 medical specialties with 75,000 e-prescriptions, 13,000 drug schedules for 4,500 drugs and 25,000 brands, where all you have to do is select the clinical condition, choose the prescription and print. That's it. E-prescriptions have never been so easy. Medical prescriptions have traditionally been handwritten. In spite of advancements in medicine, sadly and surprisingly, prescriptions continue to be manually written. Writing medical prescriptions presupposes that the individual has clear knowledge of the use of drugs and their doses. In most clinical situations, the doctor has to choose different drugs for the same condition. As for example, in pneumonia, where a pneumonia patient comes with a short duration of disease like 2 days without having earlier used an antibiotic, in this situation, you need use only a commonly used antibiotic for which you choose OP first line from the category group. Or where a patient who has already 1 or 2 antibiotics which have failed to improve the situation, in this case, you choose OP second line. Or where a patient who has comorbidities like diabetes, chronic obstructive pulmonary disease, or renal failure, in this situation, you choose COPD/DM/renal failure/CHF. Some combinations of 2 drugs have absolute incompatibilities, which the doctor has to remember and be careful while prescribing.
Proper selection of drugs is also important. All this comes from years of hard work and dedication. Even after having a clear idea of what to write, there remains the grave responsibility of clearly writing them for each patient. Writing a prescription manually entails a lot of disadvantages. For example, takes time to write. There is a limit to increasing the speed of your handwriting, and that too legibly. There is a legal requirement that the doctor should write both the generic name and the brand name, which adds to the burden of the already busy doctor. The instructions to the patient has to be written clearly and in detail, which is a repetitive task. The pharmacist sometimes has to put in a lot of effort to comprehend the doctor's hastily written prescriptions. Patients or their attendants have even more difficulty to understand the prescription. Repeatedly writing prescriptions entails mistakes due to boredom, inattentiveness, omission, carelessness, and many a time inclusion of incompatible drugs. With e-prescriptions, say goodbye to such shortcomings. Here, the information technology can help the doctor a great deal, and that's what the role of e-prescription is. The e-prescriptions are legibly printed.
Both the generic name and the brand name are printed in any combination the doctor chooses, and all this in a matter of about 2 minutes. Prescriptions can be written with either the brand first and then the chemical name, or chemical first and then the brand name, or Prescriptions can be written with only the chemical name. E-prescriptions in Prescribon are pre-prepared with age-wise dose schedules. The age/weight-wise dose schedules are categorized into 17 groups, ranging from newborn to adulthood. When you enter the patient's age, the software chooses the dose schedule appropriate for the age. Here you can see the prescription for a 6-year-old girl on the left with pneumonia and a prescription of a 60-year-old man with pneumonia on the right. So, all you have to do is define the clinical condition, in this case pneumonia, select the category group, choose the prescription and print. You can review the prescription and send it to the printer.
That's all. E-prescriptions have never been so easy. Enjoy it. So, dear doctors, kindly visit our website www.prescribon.com, register yourself and start using e-prescriptions straight away. Experience the pleasure of giving e-prescriptions to your patients. Relish it. Of course, it's absolutely free for you as an introductory offer.